In 2011, I was on my third month of being a doctor to the barrio, to the far-flung island of Polillo, Quezon. I was basically trying to navigate my way through bureaucracy and learning the ropes of being an independent clinician. We were trying to promote the DOH initiatives on that says 80% of facility-based deliveries. Basically, in Polillo, nearly all babies are delivered at home because we didn't have the right facility for it. What we really had was leaky roof, a wooden examination table, basic birthing kits, midwives, one nurse, and me. But they expected us to do the facility-based delivery because we were DTTBs. We were expected to do the DOH initiatives. And at that time, a 28-year-old female came in. She was 4'11", she was very pale, and she was referred to me by my midwife already with ruptured bag of waters. And then at that time, when I tried to examine the patient, I already saw that the baby was already coming out. The feet were already out, and the knees. So basically, it's a breech presentation. And as I was doing my physical examination, I later on discovered that this patient had a heart condition. And this was by all means referable. But at that time, we didn't have any boat. And the next referral facility was about 15 minutes away, a primary hospital, but I was also the doctor attending there. And the next facility was a provincial hospital, which was 3 hours away by boat and 5 hours away by land. So we really had no choice. We really had to deliver that baby, despite the fact that this could be a cesarean section. And then, as we were doing our maneuvers and trying to examine the baby, the heart was already failing. It took us 30 minutes to get the shoulders out, and when we auscultated the patient, the heart was about 20s. And at that time, I asked my midwives to push the uterus, and then we were trying to fully flex the hip to make sure that the pelvis was already opening up. And when I tried to feel out the neck of the baby, I felt that the cervix was already closing in. So what I had to do was that I had my fingers inside, and then trying to dilate that cervix, and then supporting the chin, and then having the baby in my arms, and then lifting it up, and then getting the head out. And it took us about an hour before we were able to do that. And the heart rate was already 20s, and the baby was limp. And we noticed that there were secretions at the nose, and what we had to do, we didn't have any suction bulb, so what we had to do was we had to suction the secretions by mouth. Sarap, grabe. So I had to do it, and then we proceeded into trying to do the chest compressions and at the same time doing the mouth-to-mouth resuscitation. And then after 15 minutes, we had that very, very, very small, inaudible, irregular cry. But I was losing my hope, and that I was trying to make sure that the baby was still alive, and then I decided to bring the patient to the medical hospital, hoping that there might be materials there for me. And then when I came there, while still doing my resuscitation, I found out that there were no IV set, there were no intubation set, there were no bag mask ventilators. And for us to use a thermal lamp, we still had to turn on the generator. So I had to continue what I was doing, just chest compressions and then a mouth-to-mouth resuscitation, and after an hour and a half, the baby's heart gave up, and that's when I pronounced the first neonatal mortality of my professional career. It was a very difficult situation for me because it made me question my adequacy as a doctor, and at the same time, it made me think about other things that might have prevented this from happening. And at the same time, it made me think that how inconsistent it is, the goals of our nations and of our nation's health, when it comes to the implementation phase. How come DOH expected us to deliver a baby when we failed miserably in referring the patient, in preventing the child's death, because we didn't have the right facility for it? I mean, whose fault was this really? But the real question is, how are we going to prevent this? So, at that time, what I realized is that a lot of our political elite write lofty goals for our nation's health without realizing that there are inconsistencies, and they are blindsided on the details of its implementation. When time went by, my views and temperament changed, being exposed to the community and learning more, and learning the dire situations of the poor and the underserved. I felt like even the mediocre opinion, when delivered in the most simple terms, might mean and might hold water against the opinions of our senators, a lot of our congressmen have any exposure to the communities. Kapag ang mahirap nagsabi, hirap dahil wala po kaming pera, panghabal-habal, paano po kami makakapunta sa inyong pasilidad na wala naman po kayong kagamitan? Mapapayap sila kami mga anak sa bahay. There's a palpable legitimacy in the opinions of the poor that I couldn't exchange for anything else. And a lot of our politicians, we realize that they have acquired opinions and solutions based on what they've read and what they seen on Facebook and assume that they already know the right solutions for the problems of our nation's health. But in reality, it's not that bad to really learn from other people's experiences, but it might lead to the danger of them not upholding to the realizations that they have because they did not have the reflections that led them to it. It can produce leaders with arbitrary values and improbable policy propositions. So, what I really wanted to point out is that grassroots communities provide the right place in finding out the solutions in the problems of our health system. And I'm addressing it to all of you, the future nation builders of our country. And I don't want to romanticize community practice, of course. I want you to consider this objectively, and I'm presenting you the positives and the negatives of my experience in the community. Let me begin with the gains. First, you gain the legitimacy in your opinions because you don't just propose solutions and forget all the rest. You become sensitive and considerate with the systemic issues while reminding yourself to be prompt in your actions. You can change the prevailing dynamics in a community because you recognize the failures of the system. You can recognize the abusers from the abused. That type of familiarity, remembering every life lost because of the failure of our society, and then you become the protector of their integrity. And then at the same time, you can advocate and challenge the benign minds working within our local government and lead them to address the right issues. I mean, there's nothing new really. It's still equality, equity, upliftment from poverty, and justice that remains to be the truest themes of our plight. That the real problems of our nation's health is not merely just addressing the pathology or treating the pathology, but rather it's about addressing the failures of our systems, the systems management, and the leadership in our health, and your presence there can challenge them. Let me point to an example. Sorry. Do we continue to support feeding programs, or instead we try to move to more longer-term campaigns like parents' classes, poverty alleviation, and food security to address malnutrition? Try to continue to and place hundreds and thousands of pesos to medical missions. And then, it's usually used for patronage building para makakuha ng boto lamang. Or do we place those hundreds of pesos, hundreds and thousands of pesos, to capacitate our local health unit to make sure that they are able to address the basic needs of our municipality? Continue the practice of home-based deliveries despite the evidence that we know that there are dangers of unsanitary home birthing practices among the poor. And how do we make use of our informal and formal political tools to make sure that we can push legislations to prevent the deaths of mothers and children in our municipality? Another gain is that you can find value and happiness in your life. A lot of us really don't know what we want to do in our lives, and we try to find a high-paying job in an effort to buy our own happiness. But not of us really find out or gain the happiness that we want. And I'm telling you this because you can, by practicing your craft in the communities, and at the same time, find your own happiness and address the inequities within our society. You can walk the marred lands, the rice fields, the mountains, and cross the sea and find happiness within the simple life. And at the same time, you can visit families and feel happy about visiting them because they didn't have they wouldn't have had the resources to see a doctor, but you're there trying to help them. And this happiness stays with you, not because you feel like you're being a hero or something, but rather you did something good. And I know all of you know how that feels. So now, let me venture into, I went that prematurely, let me venture into the negative side of being in the communities. Let me begin with victim of the politics, victim of injustice and suppression. Politicians will use you, abuse you, betray you. You will have administrators so jaded, they will hate you for being idealistic. And then, I mean, in the community, within Polillo, we still have politicians campaigning within barangay to barangay telling that what we were doing of facility-based delivery was unwarranted, just because some politician wasn't in approval because it might ruin their practice of home-based deliveries. And at the same time, you will also feel, as years pass by, that you will suffer the effects of your own mediocrity. You will find out that you're learning less, studying less, dreaming less, because of the lack of a competitive academic and professional environment within the society. Ang hirap. Kasi, meaning ko napapaisip din ako. Sometimes I would say, alam mo, masarap pagka tatambay-tambay ka na lamang, nakakatulong ka sa kapwa mo, nagagawa mo trabaho mo, okay na rin yun. Minsan napapatagay-tagay pa tayo. Ayos, pare. Di ba? Pero, what it really means is that there could be a fear of suffering your mediocrity and later on, forgetting the context of your advocacy. And at the same time, the value of everything that you have worked for. And thirdly, another negative aspect is that community participation and social activism very, very tiresome process. Advocacy, passion, and hope were the things I had in defense of burning out. But it was structured reason, discipline, that prevented me from being disillusioned. And at the same time, it was the acceptance and the familiarity of having people that really love you and value you for who you are. And that's what I got within the community. So, basically, through the 3 years of trying to, of all these hard lessons learned, usually I encounter students who are also eager young minds, and I discovered that a lot of us want to do good, be the change or make changes within our society, but they see this as something that they will do after they're successful, after they have their subspecialties. But as I say to my students, alam mo, ang pagtulong sa komunidad, parang sex lang yan. Uy, todo bigay lang. Huwag mong papahalata. Hindi. It's like sex because you really don't have to wait until you're old and successful before you do. Build your career while you're young and capable and develop that orientedness. Bakit nakakatawa? So, I guess the community has changed who I am because doing good, being happy, and working for my cause became my life's currency. And I discovered that feeling better about yourself and what you're doing really allows you to treat people better. And at the same time, through the 3 years that we tried to change the facility and then building to change the situation for the poor, we later on have our unit. And then, at the same time, the facility-based delivery from less than 6% to more than 90%. And the fact that we have nearly 300 patients being delivered within that facility. And also, trying to tackle the issues of the system, discovering the health financing, the leadership, the access to medicine, and also the human resources, and changing the face and creating positive solutions within the society. And of course, the point of all this, preventing unnecessary deaths from happening. So despite the challenges that we experience and facing a society and a government that is very discouraging for us, let me remind you that it's still our own country where we can find all the good that will give us value and happiness in our lives. And I really hope to see, imagine all of us working for the cause of helping our nation. Sama-sama po tayo, kaya nating gawin, kaya nating paunlarin ang ating bayan. At kung wala na tayo, at sa pagitan ng lahat ng ating paghihirap, tandaan ninyo, ang pag-angat ng bayan, wala nang ibang aasahan. Kung hindi tayo, sino pa ba? Maraming salamat po.